Thank you, Dr. Chaudhary, for that insightful presentation. Your presentation shows us that how climate change impact and non-communicable disease are linked, and what are the future research that we should carry out. So we'll move to our next speaker. Our next speaker is Dr. Thaisa Villa, Editor-in-Chief of the Lancet Regional Health Americas, part of the Lancet Group Global Initiative to expand quality and access to healthcare by advancing the research agenda, clinical practices, and health policy through a regional lens. Currently based in Rio de Janeiro, Dr. Villa holds a degree in pharmaceutical sciences from the Federal University of Rio de Janeiro, a master's degree, and a PhD in cell biology from the Carlos Chagos Filho Biophysics Institute. She is also a member of the Lancet Group of Racial Equity. Today, she will share lessons from the Lancet Countdown on Health and Climate Change in Latin America. Dr. Villa, welcome.
I'm really sure. Hello. Sorry, I'm gonna move this because I'm really short. Apologize. So thank you everyone for being here this morning. Thank you for the organizers. Thank you, Dr. Spinell, for inviting us again to come back to this wonderful conference every year. And I'm really I'm really happy to talk about such an important topic, timely topic, because of everything that we've seen with denial of climate change. So I think it's important to bring some numbers. And I'm also gonna start by saying that I am just a messenger here. Everything that I'm going to talk about today is the work of brilliant researchers that compound the Lancet Countdown Commission. And I'm just gonna bring their insights and their data to share with you and ignite some conversation. So the Lancet Countdown is an independent commission. So this is supported by the Lancet Group, but it's not done by the Lancet. It is actually a completely independent and multidisciplinary collaboration. And what this enterprise does is track the links between climate change and health. And they do so following this beautiful framework that I have here. And they cover 5 domains, which are they collect data on impact, exposure, and vulnerabilities. They track the adaptation, planning, and resilience at the national and local levels. They also look at the mitigation actions and health co-benefits that are being implemented by countries, the economics and finance, and finally, the public and political engagement around it. And the ultimate aim of the initiative is to provide high-quality evidence so that it can inform policy and action. And they keep tracking it every year at the global level. So since 2015, we've published the report every year, and it's a summary, it's a big review of what is the state of knowledge at that point globally in relation to climate change and health, and monitoring the impacts and the well-being, and also the national and local responses that are done. In this project, there are over 150 scientists involved, coming from more than 50 universities and UN institutions, and they're all working towards this project. So despite being extremely important to have global level data, what happened year after year as the project evolved was that they recognized that most of the good evidence that was available linking the impact of climate change in health were coming from high-income countries. And what the report does is that it collects all this evidence and proposes actions. And what was happening is that, well, we are proposing actions based on data that are not generalizable. They are coming from very specific areas. So it became evident that the global data was important, but that there was a need for regionally based chapters. And that's what they did. So since 2022, there are regional chapters inside the big countdown, and one of those chapters is the Latin America chapter. And then they published the regional reports aside of the global report. And what that was particularly important for Latin America is that our disparities, our risk assessments, our local inequalities, they are very unique. And there was this need for representation of researchers that were locally based that could do this informative research. And what is also important with the local chapters is that they can also include indicators to be tracked that are locally relevant. So for example, there are new indicators in the regional, the Latin America report that are not necessarily included in the global report because they were designed to answer a question that came from the regional research. So I forgot to move, I apologize, but it's again, the Latin America chapter is also an independent and multidisciplinary collaboration. It involves 23 academic institutions and UN agencies and more than 30 researchers representing 17 countries in Latin America. Those numbers are actually higher for the 2025 report that I'll talk about later. So for the next minutes, what I'm going to do is go over some of the high-level findings. So bring you some data, some numbers. I think most of us really like the numbers. That were the highlights of the report in 2023. And I will skip some of my notes because Rajiv just did an awesome introduction of many of the links of why each indicator is important. So I don't have to explain it again, the links. But to me, it's really hard to grasp, to understand why at a day-to-day level, it's not that obvious, the impact of heat and increased temperatures on health, because it's a direct effect. We can feel it, we can see it around us. And as Rajiv just showed us with evidence, that increasing temperatures can result in heat-related illnesses, and stroke, heat stress. It can exacerbate pre-existing conditions like NCDs, and it can also lead to pregnancy, adverse outcomes, birth outcomes, and so many other evidence that we have now. And also important, high temperatures also affects people's capacity to work and their willingness to engage in physical activity, in activities outdoors, and all of those things that we know that impacts our physical and mental health. So all that together, the past decades, as he also showed you, we've seen the increase on the temperatures globally, and the estimated average annual heat-related mortality increased by 85% due to both warming and demographic changes. If you like to put that in losses of income from the reduced labor capacity of people due to extreme heat was $863 billion in 2022. And the higher frequency of heat waves and droughts in 2021 led to 127 million more people experiencing moderate to severe food insecurity. And this is globally, but if we look at Latin America, what the report tells us is that, and this is a very busy graph, I apologize, but this is the sum of the changes in temperature in the peak of summer compared to the baseline. And what we saw in the region was an average summer temperature increase of 0.38 Celsius compared to the baseline data that we have. And this is actually just the average for the region, but the highest temperature anomalies could be as high as almost 2 degrees in Paraguay, as we observed, and Argentina and Uruguay also heavily affected with this increase. So what's more important here is that not everyone's affected the same. And the most vulnerable people are the ones that suffer the most. So children, infants younger than 1 year old and older adults, they experienced heat wave days increase of 250 to 270% in 2022 compared to the baseline data. And what I find most striking of all the numbers that I'll give you today is that heat-related mortality in Latin America among people over 65 years increased more than 140% in 2022 compared to the baseline data. So what we are seeing here is that it's already affecting us. And all the predictions that we have, the modeling that we have, is based on not increasing temperatures higher than 2 degrees. Because if we do reach the 2 degrees, then by mid-century, what we can be seeing is even worse. So it's 370% increase in annual heat-related deaths, with 50% increase in loss in work hours due to just heat, not accounting for everything else that comes with as a consequence of it. 500 million additional people experiencing moderate, severe food insecurity, and all the compounding associated health risks that Reggie just showed you that comes with food insecurity. And 37% increase in dengue transmission potential. So this is all prediction, but what the data showed us from Latin America up to 2022 is that, and the association with climate change and vector-borne disease is probably one of the most studied ones, and we have decent data associating both. And what we already know is that the potential for AIDS transmission of dengue already increased 54% across Latin America. And again, this is an average for the region, but if we look, the most significant increases were almost 145% in Bolivia, also huge increases in Peru, Brazil, and Guatemala. And this, if you remember that last year, we again crossed the record of dengue cases. This is side by side with the number of cases that we are seeing in the region. So this is a direct effect in our health, and it's compounded by the fact that across the region, we are endemic for the presence of the vector. So all we need is the transmission to continue going. Again, food insecurity, I'm going to go back because what I showed you before is what if we reach 2 degrees increase, but what we already have as data in the 2023 report is that in 2021, 9.9 million people experienced moderate to severe food insecurity. 9.9 more people enter this level of insecurity compared to the baseline data. So this is almost 10 million more people in food insecurity, just what we already have and it's just the beginning. So the high number of heat wave days directly increase 4% of food insecurity. And that's a separate indicator from the frequency of droughts. So they both, in fact, impact food insecurity in different ways. So what is also interesting, well, I just forgot to say one thing, and I keep coming back to this point because it's really relevant for us, but the highest risk people here are the ones that are already in low income levels, because those are the ones that will move to a food insecurity level. And this is just showing us that climate and social factors go side by side, and the governance behind it is going to impact directly those populations first. So that I wanted to bring because one of the important data that also comes from those reports is that not only they are tracking the direct exposures that we already have and the outcomes, but also how the nationals and the countries are responding and assessing that. And why that's important? That's important because if you don't do a risk assessment at least a country level, you're not going to respond to what's actually a priority in your country. So think of Brazil. Even a national assessment is not going to answer what is a priority at a risk level for the whole country, because you have floods being the most important on one side and droughts in the other, and then urban areas not receiving basic needs in the other area. So the national assessment is the key part of understanding the risks that each country faces and adapting to it. So what the report does is track how each country is doing. And so assessing the vulnerability and adaptation is complex, yes, but it's essential. And from the 7 Latin American countries that committed in COP26 to develop climate resilient and low carbon health systems, from those 7 countries, up to 2021, only Brazil, Guatemala, Argentina, and Panama actually conducted a vulnerability and adaptation assessment. On the good side, because my colleague Rigi just finished with a very up high and positive message, and I just don't want to talk all about the negatives, but on the positive side, this is what conducting this evaluation allowed Argentina to actually pass a Green Climate Fund preparation and preparatory support program, which is what's going to fund the country's direct implementation of mitigation acts. So having the national plan is part 1. And many countries, as you can see in that map, many countries do have a national evaluation plan, but they are mostly looking at the climate changes across various sectors. And very few of them are looking at health specifically within this context. And even fewer have specifically health national plans. Actually, only Brazil, Chile, and Uruguay have a national adaptation plan that's focused on health and how we're going to protect health of people in this context. So if that is at national level, that's the minimum, and we're not doing it. But at the city level, and why city level is important? Well, 80% of Latin American people live in urban centers. And unplanned urbanization, as we probably know from across the region, is one of the biggest issues. And inadequate governance in that area can exacerbate and amplify social impacts and disparities. So the importance of acting local for adaptation in the context of climate change is essential, but we only know about 1.7% of risk assessments at the city level in Latin America. So this was the only assessment that was conducted, and it involved very, very few cities, and that's the data that we have to work with at this point. So we don't really know at the local level what are the specific vulnerabilities associated with health that needs to be prioritized on those cities across the region. But from what we know, we already know that it's quite different from South America to Caribbean. We know if we evaluate the risks that what needs to be a priority here is not necessarily a priority there. So this is why we really need to expand the collection and the assessment of the risks across the region. And finally, I want to talk about, this is the last topic related to this part of the assessments, and it's about green urban spaces. Green urban spaces are the easiest, I don't want to use easiest, but they are an incredible adaptation measure because they tackle two of the biggest issues that we have, which is heat and pollution. And you can do that by just protecting the green spaces that you already have and also expanding it. And you can expand it by turning abandoned buildings or into parks or rooftops into green areas. And that has also a positive effect on people's well-being and mental health and increases exercising and recreation areas. But from the 109 urban areas that we analyzed, there are none of the cities were classified as high or superior level of green spaces. Only 12 centers had moderate levels, and even the ones that had modest increase in Colombia, Nicaragua, and Venezuela still have disparities between the quality and the places and the accessibility to those green spaces. So again, the people that will access those green spaces are not the marginalized ones. So my first key level message is that Latin American countries need cross-sector public policies that increase climate resilience, reduce social inequities, improve population health, and reduce greenhouse emissions. I have a few data on greenhouse emissions, and they are quite striking. So 60.1 million people in Latin America depend on polluting fuels and inefficient technologies for cooking, and that generates greenhouse emissions. So almost 20% of Latin Americans don't have access to clean cooking, and that can be as high as 46% in some areas, such as rural Central America. So a higher percentage of people have access to liquefied petroleum gas, which is a little bit better, but it's still polluting. And fossil fuels are still dominating the energy and the transport for the entire region. So you get where I am going with this. And the premature mortality due to pollution, as also Rajid already alluded to, and ambient pollution is one of our biggest threats in Latin America. Not a single urban center meets the WHO guideline for the maximum of PM2.5 exposure. So not a single country that we looked at. And premature deaths continue to increase related to PM2.5, as well as increased mortality rate related to PM2 and ambient or air pollution. So we are not doing a good job at our emission or pollution, which are the two biggest killers in this context. So my second message is that countries need to accelerate energy transition to prioritize people's health and well-being, reduce energy poverty and air pollution, and maximize health and economic benefits. And my final data is about who is generating those emissions, and that's coming basically from agricultural. And the one data that I'm going to leave with you with is that 40% of Latin America's greenhouse gas emissions come from exploiting agricultural land. That's 40% of the entire region emission, not only agricultural emissions. And this is the key area where we can make a difference. But the problem is that we are still not financing transition out of fossil fuels enough. So my final message is that we need to increase finance through permanent financial commitments and multilateral development banks to foster climate resilient development. A positive note is that last year, in 2022, we did exceed investments in clean energy compared to fossil fuel, but every single country in the region is still subsidize fossil fuel development, and we are seeing an increase in pushing for it. So this is a reverse in the pathway that we should be trailing. So I'm going to skip this because I am over my time, but I'm going to invite you to look at the new data that's coming in October 29. So you notice that this is 2023 data is the most updated that you have at this point. But we are launching the new countdown report together at the global and the Latin American reports at the same day on the 29th. And we're going to have a series of webinars to delve into the data. So I welcome all of you to keep track, keep looking for the dates. I unfortunately still don't have the link to register to it, but it's coming. So this is just to show you the face of the people that are actually generating this data and that actually did all the job, and those amazing people behind everything we know of the state of the links within Latin America that we have so far. Thank you so much, and I'm sorry for going over a little bit.